Hello, my name is Joni Leverton, and I will be discussing Medicare fraud and how healthcare providers have been affected by this issue. We will also be discussing what we can do as healthcare managers to prevent Medicare fraud and all the ill side effects that come with it. Medicare has made access to healthcare a universal right for Americans once they reach the age of 65. This has helped improve the health and longevity of older Americans. Medicare was created in 1965 when people over 65 found it virtually impossible to get private health care insurance. Lyndon B. Johnson is shown in this picture signing Medicare into law on July 30th, 1965 at the Harry S. Truman Library. He chose to sign this law into practice here because Truman was the first president to publicly endorse a nationally health insurance program in 1945, which was unsuccessful. As a senator, Truman had become alarmed at the number of draftees who had failed their induction physicals during World War II. For Truman, these rejections meant that the average citizen could not afford to visit a doctor to maintain their health. Congress created Medicare under the Title 18 of the Social Security Act to provide health insurance to people 65 and over, and younger people with end-stage renal disease and Lou Gehrig's disease. Medicare A is hospital insurance. Everyone who is eligible for Medicare receives Medicare A benefits automatically. It covers inpatient hospital care, skilled nursing facility care, home health care, and hospice facility care. Medicare Part B is medical insurance. It is optional and you must pay a premium. Medicare Part C is a Medicare Advantage plan. This plan offers more coverage beyond Parts A and B. A private insurer offers these benefits and it requires a premium to be paid to the private insurer. Medicare Part D covers the prescription drugs and is optional. It requires a premium and is offered through private companies also. 48 million Americans were covered by Medicare in 2010. Of this, 40 million people were age 65 and over, while 8 million were younger with disabilities. This is a lot of people that depend on Medicare for coverage, and this coverage comes at a high price to the government. Fraud is the act of obtaining something of value through misrepresentation or concealment of material facts. Medicare fraud can and has been committed by individuals, medical groups, and even organized crime. Medicare is a target of wide-spectrum fraud, waste, and abuse. Medicare fraud has and continues to cost the taxpayers a lot of money. Some examples of Medicare fraud include services not rendered. This happens when a healthcare provider bills for services or supplies that were never performed or provided. Upcoding occurs when a higher level treatment is billed rather than the lower level treatment that was performed. Unbundling occurs when a healthcare provider bills separately for services that are already included in the primary procedure. Underutilization occurs typically in capitation contracts. Physicians will provide not enough care or they will delay needed care under this type of Medicare abuse. Services that are rendered but they are not medically necessary constitute as Medicare fraud. A common example of this is adding unrelated history or review of systems to office visits to drive the key components required to bill higher level of E&M codes. The ICD upcoding involves utilizing false or inflated diagnosis codes for encounter information to increase premiums. As a result of the large amount of Medicare fraud and abuse in the past, the federal government has developed many mandates and laws to battle this problem. It is crucial to understand these laws because violating them can result in criminal penalties, civil fines, exclusion from federal health care programs, or loss of your medical license from the state medical board. The False Claims Act protects the government from being overcharged or sold shoddy goods or services. It is illegal to submit a claim for payment to Medicare or Medicaid that you know or should know are false or fraudulent. Specific intent to defraud is not required under this act. Filing false claims can result in fines up to 3 times the program's loss plus $11,000 per claim filed. Criminal penalties can be accrued for submitting false claims under this act. The anti-kickback statute is a criminal law that prohibits the knowing and willing payment of remuneration to induce or reward patients' referrals or the generation of business involving any item or service payable by the federal healthcare programs such as Medicare. Under this act, physicians who pay or accept kickbacks face penalties of up to $50,000 per kickback, plus 3 times the amount of remuneration. Other penalties include jail terms and exclusions from participating in the federal health care programs, such as Medicare. Stark law prohibits physicians from referring patients to receive designated health services payable by Medicare or Medicaid from entities with which the physician or immediate family member has a financial relationship. This is a strict liability statute, which means proof of specific intent to violate the law is required. Penalties include fines and possible exclusion from participation in the federal health care programs, such as Medicare. The criminal health care fraud statute prohibits knowingly and willfully executing or attempting to execute a scheme to defraud any health care benefit program. Proof of actual knowledge or specific intent to violate the law is not required. Civil monetary penalties may be imposed for a variety of conduct and different amounts. Penalties and assessments may be authorized based on the type of violation at issue. Penalties range from $10,000 to $50,000 per violation, or up to 3 times the amount claimed for each item or service, or up to 3 times the amount of remuneration offered, paid, solicited, or received. President Obama recently signed off on legislation that very likely will result in a substantial increase in lawsuits against healthcare providers. Intended to combat fraud in the Medicare and Medicaid programs, several amendments in the Patient Protection and Affordable Care Act significantly change the status quo and will require greater vigilance by healthcare providers in their dealings with the federal government. This new law is projected to provide $250 million over the next 10 years to help investigate and prosecute healthcare fraud. One example is, under this act, a healthcare provider who, upon a discovery, fails to report and return an overpayment by Medicare within the time required by the new law will, in addition to the amount of the overpayment, is subject to civil penalties. They must report and return the overpayment within 60 days. There are many government agencies that are involved with Medicare and the investigation of Medicare fraud. The Centers for Medicare and Medicaid Services is a federal agency within the Department of Health and Human Services that administers and oversees the Medicare and Medicaid programs. The Center for Program Integrity promotes the integrity of Medicare through audits and policy reviews, identification and monitoring of program vulnerabilities, and support and assistance to states. The Office of Inspector General protects the integrity of the Department of Health and Human Service programs such as Medicare. It does this through a nationwide network of audits, investigations, inspections, and other functions. OIG has the right to exclude individuals from participations in Medicare and other healthcare programs, plus they can impose fines for certain misconduct. Healthcare Fraud Prevention and Enforcement Action Team, or HEAT. Ooh, this sounds intense, doesn't it? HEAT was established to build and strengthen existing programs to combat Medicare fraud while investing into new resources and technology to prevent fraud and abuse. General Services Administration maintains the excluded parties list that includes information on entities that have been disbarred, suspended, proposed for disbarment, excluded, or disqualified throughout the U.S. government from receiving federal contracts or federal benefits. There has been and continues to be a large amount of Medicare fraud, as the payout can be large, but the government, as we have just covered, has developed many reasons for you not to want to attempt to defraud the healthcare system. But many of those laws do not require a party to purposely attempt to defraud the healthcare system. What can the many legitimate healthcare providers do to prevent committing Medicare fraud and possibly suffer the financial loss of fines or other penalties? Healthcare administrators need to develop written policies, procedures, and standards of conduct that articulate the organization's commitment to comply with all appropriate federal and state standards. Designate a compliance officer and compliance committee that are accountable to senior management. Make sure your facility has effective training and education between the compliance officer and the organization's employees, managers, and directors. It is everyone's responsibility to follow the law and not commit Medicare fraud. Keep effective lines of communications open between the compliance officer, members of the compliance committee, employees, managers, and directors. Have strict enforcement of standards through well-publicized disciplinary guidelines. Develop guidelines for internal monitoring and auditing. Develop procedures for ensuring prompt response to detect offenses and develop corrective actions. Have a compliance plan that includes measures to detect, correct, and prevent fraud, waste, and abuse. Healthcare managers have the challenge of staying committed to understanding the past, present, and future developments of the many healthcare laws. An organization that does not stay educated and makes the needed changes as required is risking more than it is gaining in committing Medicare fraud. Thank you for taking the time to watch my presentation. This is a hot-button issue and is constantly changing. Please feel free to contact me with any questions or comments.